Sessions have heard this, but when I was very young, a gentleman explained to me that the mark of a good chair is starting on time and ending early. So we will attempt to achieve those goals today, although I am not the chair of this event. I'd like to introduce the people who have worked so hard and done such a good job. But I also have to introduce Dr. James Tulsky, who is the vice chair of the Roundtable. And again, as people who've been to the Roundtable meetings understand, it is my job to take credit for the success of this organization, and it is James's job to know what's going on. So he will inform you about that in a minute. James and I and a number of other people here, including Diane, served on the committee that authored the Dying in America report, and that's the basic document that we began with. And then the NAM created this roundtable to try to find ways to facilitate implementation of many of the recommendations and in fact, and perhaps go beyond that to help facilitate other activities that would result in better care. Today's workshop is the second in a series of workshops that are hosted by the Roundtable, and your briefing books contain information about the next Roundtable, sponsored workshop on financing and payment models, which will be held in November. James and I are looking forward to today's presentations, and in an effort to both start on time and end early, I will now introduce Dr. James Tulsky.
Thank you, Leonard. It's truly a pleasure to help welcome all of you to this workshop today. And the only thing I want to say about it is that when I saw the work that the committee had put together and the people that they had brought in and the programs, it's incredibly exciting to me because we usually tend to look, certainly as somebody who's in academia, I'm used to looking toward academia for various kinds of models and innovation. And in fact, that's probably not where it's really happening right now. And what I love about the workshop that was planned for today is that they've looked out to find those organizations, those individuals, those groups around the country that are doing incredibly innovative things with various kinds of resources and various kinds of environments, and very much really present models for us to be thinking about and that we can all learn from. So I'm very excited to hear what we're going to be talking about today. And what I would primarily like to do is to introduce and to thank profusely the two co-chairs of the committee that organized all of this, Diane Meyer, who's the director of the Center to Advance Palliative Care, and Brenda Nevijan, who is the who's the CEO, Chief Executive Officer of the Oncology Nursing Society. The two of them have done incredible work, and I will let them acknowledge the rest of their committee, which has also done the work as well. So thank you so much.